Hi, everyone. Welcome to the Technology and Innovation Workshop session, Finding Digital Connections for Rural Communities. Thank you all so much for joining us today. We're excited to talk about this topic and hear from our great presenters. So today we're going to hear from 4 presenters doing innovative work at the intersection of technology and rural communities. First, we're going to hear from Dr. Allison Gustafson, Director of Dietetics and Human Nutrition at the University of Kentucky. Then we're going to hear from Zareena Meyn, Executive Director of mRelief, and Griffin, Food and Nutrition Coordinator with Catholic Charities of Northeast Kansas. And finally, we'll hear from Gloria Dickerson, CEO and founder of We Together Creating Change. So I'm Chloe Eberhardt. I'm a senior program manager with the Center on Best Practices with No Kid Hungry, and I focus on SNAP access. So that really is a big part of today's session as well. So I'll have us move to the next slide. All right, so I just wanted to set the tone a little bit about SNAP, just to give some context that I think will help with the rest of the session. So SNAP is an acronym that stands for the Supplemental Nutrition Assistance Program, formerly known as food stamps for some, and it provides food assistance to eligible households through monthly benefits received on a debit-style electronic benefits transfer card that's used to purchase food from approved retailers. SNAP is an extremely critical program. It's our largest federal nutrition program here in the United States. And last year, it helped feed over 41 million Americans. So it is also the largest child anti-hunger program. So nearly half of SNAP recipients are children, and 2/3 of SNAP benefits go to families with children. So it's a really critical resource that the folks we're going to hear from today know and want to help ensure families get connected to. So it's really important because SNAP helps in many different ways. A few I wanted to call out are it reduces poverty. SNAP lifted over 7 million people out of poverty, including 3 million kids. And there was a recent change in the benefit levels they increased this past fall. And doing that also additionally will permanently lift 1 million children out of poverty. So it's really, really important. It supports local economies. So when SNAP's received, it's often spent within the same month of receipt in communities where people live. And for every $1 in SNAP, it generates $1.70 in economic activity. And finally, I know for many of you work in schools, and SNAP is really critical for schools as well. It ensures that kids who receive SNAP are directly certified for school meals, meaning kids get those meals for free and families don't need to submit an application, which saves districts time collecting those applications and also helps district finances to get that full reimbursement. So we really see that connection between SNAP and the critical work of schools. But we know that nationwide, not everyone who is eligible for SNAP is accessing the program. So 18% of eligible people aren't participating, which means nearly 1 in 5 people who are eligible for SNAP are missing out on benefits. And a lot of folks today are going to talk about some of the strategies to help ensure people are accessing benefits, lowering barriers in the application process, and then also lowering barriers for using benefits after they receive them. So I'm excited to hear about how technology and online services can make SNAP more accessible and really help close that participation gap. All right, thanks for being here.
Hi there, I'm Dr. Allison Gustafson, and I am excited to share today. So as the first speaker, I'm going to talk a little bit about our work that was funded by No Kid Hungry, Share Our Strength, and Instacart. And what this intervention did, it was an online grocery shopping intervention among lower income and SNAP households. Next slide. So the overview, I'm going to talk about what that online shopping intervention consisted of and what we did. Then I'm going to talk about the qualitative interviews we conducted among our SNAP customers across several states, and really wrap up with what does that mean for policy at the state and at the local level, in addition to the federal level. And then I'll leave some time for questions and thoughts. Next slide. Okay, so what did we do here at the University of Kentucky? We had an online shopping intervention. And what that was is one group got online ordering plus intensive intervention messaging. So they were tailored nudges 3 times per week that focused on meal planning, meal preparation tips, and support for maintaining online shopping habits. They also got a Facebook group for social support. We really focused on these constructs because previous research has shown that meal planning, meal preparation, and recipes helps not only stretch your food dollar, it helps improve food security, and it helps improve your purchasing power. So if you kind of think anecdotally about those weeks where you know when you're going to eat, what you're going to eat, you overall eat healthier and you also spend less money. And then if you think about those weeks where you're very, very busy, you got 2 jobs and you're running around, and then you're shoving in McDonald's or you're shoving in just different types of food, your money just kind of goes faster and you end up not making healthier choices. So our idea is that online shopping really helps you. It forces the person to plan their meals and to really think about it. However, people need help with that. It isn't just hop online and it's super easy to do, right? So that's why this arm of the intervention really focused on these tailored nudges, meeting people where they are and helping them with these components. The second group received just online ordering. So we wanted to see, is it just if you simply order online, will that help you with those kind of components, right? Of, healthier choices and purchases. But they did not receive any tailored nudges, and they did not receive any Facebook or social support. And then the third and final arm, which is kind of our comparison group, is called brick and mortar. And so they were told to just keep shopping how they normally shop and go to their store that they normally choose to shop in. And this is called our comparison group. So both the online groups received help setting up that cart, because sometimes we learned that was a barrier for people, was that initial setup. And then they also had $5 per week to defray fees. And it also helped them to return our text messages as well. So kind of an incentive during the week to keep on track. Next slide. Okay, so what did we find? I'm going to jump right into it because we don't have much time. So during the intervention, the online only group, so remember that group that they didn't get nudges or anything like that. So what did they purchased? They shopped still. 60% of their food purchases were conducted online. So even though they didn't have any nudges or kind of that within the week assistance, they still shopped quite a bit online. But then that online plus intensives, remember how they had all that support? They shopped online 65% of the time. So the intervention helping people get going really shows that once you get them going, they will shop online for food. And you're going to see in the next slide of why we're kind of excited about this finding. So the next slide. So as our hypothesis thought, and we were so excited, is that the online plus the intensive intervention group specifically increased purchases of fruits and vegetables. And this included fresh, frozen, canned, and dried. It also included some soups. While spending on the overall bill was the exact same. And we really want that to be, because number one, we need our grocers to be partners. And so if they see that they're losing money, they won't necessarily partner with us. So that's key. And then number two, we want to make sure that people are not spending any more online, especially for the type of customers that we're targeting, which are SNAP and lower income. So we know that they spent about, on average, close to $7 or $6.84 more on fruits and vegetables, but their total bill stayed the same. So this really points to how an online shopping plus this social support with messaging and intervention key targets about meal planning, meal preparation, and recipes really helps people stretch that food dollar the exact same amount, but increase the amount they spent on fruits and vegetables. Next slide. Okay, so we recruited a pretty equal sample of urban and rural residents. So this is where we kind of delved into the details a little bit more. So we know that the urban shoppers feel that their online prices are affordable relative to our rural shoppers. So those rural shoppers kind of are looking at those online prices and said, they seem higher to me than if I was in my store. And one of the reasons for that is because in rural communities, there's less stores offering online. So a lot of times they can only pick from certain vendors or certain food venues that offer online, where urban, guess what? Lots of opportunity for online shopping. So this is one policy that we really would like to focus on, is access among our rural shoppers. I'm going to move down. Now we find that more urban shoppers have an option for delivery compared to rural. Probably everyone on this call will not be surprised by that finding, but it just really highlights the need for our rural communities to have equal access to healthy food and healthy delivery options, just like just like urban. And the other key point here is that we know that our rural population is aging. And so if there was ever a moment that delivery could really help an aging rural resident, it would be now. Think about being able to pick up milk, heavy waters, any of those bigger items. If you're an elderly or an aging person in a rural community, you might forego those options. However, if you have delivery, you might be more willing to then order some of that healthier food that might be heavier. The third thing we found looking at that rural urban, more urban shoppers than rural report that online site isn't difficult to use. I think this again points to our rural shoppers tend to be a little bit older. And so helping them navigate. So you will see with the policy suggestion is that we need, as far as communities, to help our rural shoppers set up their cart. So if you recall from that first slide of results, once you help people set up their cart and get going, they're more likely to shop online. So I think it just requires a little bit of community engagement on our part to help those rural shoppers set up their cart. So there are opportunities to facilitate online ordering in rural areas. We can partner more with third-party providers. We can work with local grocery stores, and we can work with our government entities to decrease the barriers to online onboarding of those stores. Next slide. So remember how we also then interviewed SNAP customers who were part of this online intervention. Some were in the brick and mortar, some were in online only, and then some were in the online plus all those intensive interventions. So we had 64 households that participate in SNAP. They have children because we wanted to make sure we understood that dynamic, and they live in urban or rural communities. So we were open to both geographies. Next slide. Great. So what did we find when we did these interviews? And these were 30 to 45-minute interviews. So what did our SNAP customers tell us? They told us challenges to online shopping are pickup times, substitutions, and selection. So pickup times are not always convenient for when SNAP customers need to pick up their food. Maybe they're working 2 jobs, and so they need to go at 8 at night when there's not a pickup time, especially among our rural communities. In urban, there's a greater variety of pickup times. In rural, it's much more limited. The second theme that we found, and this has been perverse across everyone I've ever interviewed on this, is substitutions. People who make $1 million a year to people who make $1 a year. People are quite upset about the substitutions, and they want those shoppers to be able to not have a substitution. So if you have strawberries and strawberries aren't in the store, they don't want you to substitute it with blueberries. They want strawberries. And so that's something kind of like a supply chain issue is how I look at it. So probably nothing that I'm going to change today with this intervention, but something to think about. And then sometimes the selection is not exactly what they want online, and that kind of points back to the substitution. Here were some positives. Convenience, it's quite easy. Privacy, they loved being able to not have to share their EBT card at checkout and the privacy that they felt online in their home. It obviously is a huge time saver, and there's less stress having to go into the store with your children, right? That's a big point. Spending differences. SNAP customers report spending less when they shop online. And remember, this kind of comes back to those findings of the online shopping where the bill was the same. There's less impulse buys. You sit down to your computer, you say, these are the items I'm going to buy, you put them in your cart and you check out. You're less likely to do the grab and go kind of items. So this is such a great opportunity for our research and our policy to help these SNAP customers stretch their food dollar and decrease that impulse purchasing. And everyone reported that it's quite easy to use your EBT card online. So that was good to hear. Next slide. Some other ones were shopping preferences. They said it's easier to browse items if there's an app or if it's on their computer. So it would be great if the phone features were mimicking what they could see on their laptop. So I think that's really important for when we're working with USDA on these SNAP offerings, what it looks like on screen. Coupons, there was a lot of enthusiasm and ease of using online coupons and linking their account to those coupons. So that's a great avenue to focus on. Purchasing variety, they said there was consistent availability between online and in-store. Overall, there was availability of their preferred foods, which is key because you're not going to shop online if you can't have the food you like. And the online, because they would see other suggestions, they were open to trying new foods. So a lot of SNAP customers reported that when they would look at broccoli and then a different green vegetable would come up, they were then more open to trying that out. So that's another great avenue for us to explore as we move forward with SNAP Online. And then the last part, which of course, I was excited because this is what we thought our research would find, is that it really helped reduce that impulse buy. So it helped them with meal planning and meal preparation. And they weren't as likely to fall gimmicky to some of the advertisements that they saw online through this intervention program. Next slide. Okay, so just here's some illustrative quotes. So if you see the next one, so it was, as far as I knew, everything they had in the store was listed online pretty much. So that's great to hear. I did change up when I had looked online. I'd seen some stuff that I hadn't even seen in the store. So I changed up a meal. So again, this online is helping them change some of their food options. I was like, oh, I'm going to do this instead of that. I was more open. And then the last one's I saved money. If I'm in a store, I'm going down every aisle and I'm just picking up random stuff. And I end up spending more money as opposed to being here, opening the refrigerator or the cabinets and being able to know what I need and what I don't need. And it's making me meal plan more and stay away from just getting random food. So we were just so excited to see that, just right there in print. And so I think this online has a lot of capacity for helping our SNAP customers. Next slide. I'm going to skip this one just for time's sake. So you can just go to the next one. I'm a talker, so it gets me going. Okay, so just to summarize those SNAP benefits, we say that there's convenience, there's less impulse buys, there's less or similar spending, and it improves their meal planning. So I feel real confident that this is a great area that we can be exploring as we move forward. Next slide. So here are my takeaways from both sides of it. So from the intervention and the qualitative interviews. Online shopping holds great promise for SNAP customers. Prices are similar and customers report spending less or equal what they would spend in store. They also report trying new items, especially with coupons. And qualitative and quantitative results support this point. We also know that SNAP customers remain excited about online shopping. Although there are barriers with pickup times and substitutions, SNAP shoppers still report a desire to continue online shopping given the other benefits. Next slide. So what are some implications from our finding? Online platforms can be leveraged to support families seeking to make the most of their food dollars to purchase affordable, nutritious food. Tailored shopping tips related to meal planning suggestions and easy to use coupons can help. However, rural communities face additional barriers to online ordering, and I can't stress this enough. It is important to address challenges experienced by both retailers, so the grocery store managers in rural communities, and customers in rural areas to support access to online ordering, including our SNAP and EBT customers. Online platforms could potentially serve as an entry point to facilitate enrollment for SNAP or other programs. So when we think about those online platforms and someone is placing their order, that is a great opportunity to alert people to, have you thought about enrolling in SNAP? Here's your SNAP office, here's a hotline, here's the link. So this is just one way that would be a great entry point for enrolling our SNAP customers. Next slide. So I think I'm going to end it here with discussion, but I believe we're going to end the whole session with discussion. So I will pause and introduce you to the next speaker. Thanks so much.
Hi there. If you can go to the next slide. Great. Okay. Thank you so much. Hello, everyone. I'm Zareena Meyn, and I am the Executive Director of the nonprofit mRelief.
And then I am Griffin. I'm the Food Nutrition Coordinator at Catholic Charities of Northeast Kansas. Next. Here, Catholic Charities of Northeast Kansas, I oversee SNAP outreach, nutrition education, and our child nutrition programs of our summer food programs in CACFP. So here we, here we serve the most vulnerable men, women, and children of all faiths across the 21 counties and ministry of the Archdiocese of Kansas City, Kansas in Kansas. We provide innovation programs and solutions that stabilize and strengthens individuals and families, moving from a place of needing hope to one of having hope. We serve families at our 7 family support centers and 8 food pantries and the resource bus, who provides services to the 15 other rural counties. So we collaborate with a variety of community partners, such as the KSDE, USDA, CCUSA, and mRelief, to increase awareness and access to local as well as federal food programs, including the Supplementary Nutrition Assistance Program, known as SNAP. So here before COVID-19, we provided SNAP assistance in person. We had specific SNAP assistant days, or people were able to show up and receive help filling out their applications at our family support centers or at our resource bus. Applications were then taken to local DCFs or submitted online. This process took individuals 45 minutes to an hour, but could take longer depending on family sizes. During the pandemic, we saw the need, and our family support centers continue to serve individuals and families, but face-to-face contact was limited. Next.
Great. So Chanel told us that when the pandemic hit, Catholic Charities operations were significantly limited and SNAP enrollment wasn't as possible as it was before. And of course, during the pandemic, it was really more important than ever for the Catholic Charities to be there for their community. And I think that mRelief was one of the tools that helped with that. So like I said, mRelief is a tech nonprofit, and we exist because 9 million people who are eligible for SNAP are not enrolled. And our mission is to transform access to social services for the inherent dignity of all. So you can go to the next slide. Okay, so I'll talk you through the experience for somebody who may be facing hunger in rural Kansas. Let's say her name is Jen. So when Jen logs into Facebook using her smartphone, she will see an ad for mRelief that provides some information about SNAP. And when Jen clicks the ad, that will take her to mRelief's SNAP eligibility screener, which she can complete in less than 3 minutes by answering 10 simple questions about her household. Next slide. So once Jen learns that she's likely eligible for SNAP, she has a choice. She can complete the application right now using her smartphone, which takes about 20 minutes. Or maybe, let's say Jen is a mom, so and her child has just woken up from their nap. So Jen needs to schedule another time to work on this. And if she has limited access to the internet, she wants to do it over the phone. So you can go to the next slide. So that's when mRelief can connect Jen to the staff at the Catholic Charities to help her apply for SNAP. So Jen can schedule an appointment at a time that works best for her with one of Chanel's colleagues, and they'll call her back at the time of her scheduled appointment to complete the SNAP application with her over the phone in less than 30 minutes. And the technology that facilitates this is called Johnny, named after the legendary welfare activist Johnny Tillman. And it's a client relationship management system that was designed to connect people who need help applying for SNAP to the caseworkers and helpers in their community at the Catholic Charities who can help them apply completely remotely, which was really important during the pandemic. So you can go to the next slide. So after Jen has completed an application over the phone with the staff at the Catholic Charities, the next step is that she has to upload her documents, which she can do by simply taking a photo of that required document using her smartphone and uploading it securely to mRelief's website. Or she can send it over text messaging securely, and we will review those documents and submit them along with her application to the Department of Children and Families in Kansas. And since we know that Jen's a mom, she's super busy, she's going to receive automated follow-up text messages to remind her to complete this crucial part of the process. So once Jen's documents are submitted to the state along with her application, she will receive a call from the Kansas's Department of Children and Families, and they'll carry out the final steps of the application process before she's approved for benefits. Next slide.
Now that Jen has applied for SNAP, we can connect her to other resources to meet the individual's and family's holistic need. So here at Catholic Charities, we're able to provide rent and utility assistance, financial education, clothing assistance, access to the food pantry, employment support. And then individuals and families can also participate in a double bucks program, which is where your SNAP dollars, which doubles your SNAP dollars on fresh vegetables and fruits at farmers markets or specific grocery stores. And then also in our local extensions offices, they also provide a variety of classes for low-income individuals. Next slide. So mRelief's system collects data so we can keep track of our impact in the community. Through this partnership, we've been able to increase applications for families in rural Kansas by 200%. Next slide.
Okay, so Chanel and I talked about what worked to achieve this awesome success, a 200% increase in applications. And we came up with 4 things that community-based organizations can replicate. So those are outreach, accessibility, choice, and follow-up. So starting with outreach, mRelief used Facebook to reach people in the community who may not have known about the support that the Catholic Charities provides in the first place. And Catholic Charities distributed flyers to their existing clients who may not have known about SNAP. Next, accessibility is really important. Earlier today, Secretary Cardona mentioned that rural communities are hit a lot harder by the digital divide than other communities in this country. So it was really important that Jen could complete this entire process using her mobile phone without regular access to the internet or a computer. Next, we give clients a choice. So Jen could choose how she applied in a way that worked best for her. She could apply from the privacy of her own home on her own time, or she could apply with the assistance from the Catholic Charities over the phone remotely, which was safe during the pandemic. And so since clients can self-select the option that works best for them, that really liberates the capacity of Catholic Charities to focus on the clients who really need that one-on-one assistance to apply. And then the last step is really follow-up. So Jen was prompted with reminders about next steps in the SNAP enrollment process, just to make sure that she had end-to-end support each step of the way. And then Catholic Charities was able to connect her to other resources that she may be eligible for besides SNAP. So next slide.
The impact of this partnership has meant that more than 2,000 families in rural Kansas were provided with SNAP information, resulting in nearly $2 million in SNAP benefits being unlocked for those families. Next slide. So when people are food secure, they have the strength to overcome life's other challenges. Diana, a single mother of a nonverbal son, was sleeping in her friend's couch after fleeing a domestic violence situation. When she first met with Catholic Charities of Northeast Kansas case manager, Diana had no permanent housing, no income, no source of food, inconsistent transportation, and legal barriers. As Diana worked with a case manager to solve her housing situation, she applied for SNAP benefits. Receiving these benefits for her and her son relieved a large source of anxiety for Diana. Now she is working part-time, pursuing her GED, has secured legal assistance, and was approved for supplemental security benefits for her son. In April, Diana and her son signed a lease of her new home. For Diana, the first sign of hope came with her SNAP benefits. Knowing that she and her son would not be hungry gave Diana the strength to overcome challenges and pursue her goals. And next.
Thank you. Yeah, that's it from us. So we'll pass it over to the next speakers.
Hello, I'm Gloria Dickerson, and I'm from Drew, Mississippi, in the Mississippi Delta. I'm glad to be with you all this afternoon to talk some about what we have done to try to assist people in the community to have access to food. Our project is and has started as a community project, and we got together to see what the community needed in terms of needs in the community. And one of the things that really came to the top, that was a major priority, was we need access to food. The grocery store had closed here, and the only grocery store was probably about 20 miles away. And the people were concerned and dissatisfied with the fact that they had to travel at least 20 miles to get groceries. And they were dissatisfied because they didn't have any transportation, or either they had to pay someone to take them to get their food. So even though they may have had the food stamps or the money to get the food, they were saying it's costing too much money for us to have to go and get our food. And so what we did, next slide, please. Next slide. So I'm going to reiterate that there was no grocery store, nowhere to buy an orange, an apple, celery, anything like that in the area. And so it was very disappointing for those people who did not have transportation. Okay, the next slide. And so we did a survey in the community, and we wanted to ask people about healthy living and healthy food. We wanted to know how important is a grocery store here. Would you shop at a grocery store if was a grocery store here, so you can support that grocery store, and the grocery store would stay in the community without leaving? And so most people said that they would. They were interested in healthy living. They wanted some healthy foods in the community, and they would shop and get healthy foods if they only had somewhere to get that food. Okay, the next slide. So we went out and we tried and did an analysis with our partners, our community partners, to do an analysis of what would it take to get a grocery store in our community. We looked in other communities to see what they were doing. We traveled to see what the other communities had in their community, how they went by getting a grocery store. We talked with the wholesalers about could they bring a grocery store to Drew, Mississippi. And what we got was that because of our demographics, they weren't going to be able to bring a grocery store to the community. So here the community is saying, okay, we have no way to get our food. Some of us do because some of us have transportation, but most of us do not have transportation to try to go and get our food. And so what we did, he said, so if we can't get a grocery store, let's start thinking about the next option, another option. How can we get food to people? How can we get them to eat healthy and those kinds of things? And so the next option, well, let's do a grocery online ordering service, and a distribution service, delivery service. If you can't go get your food, then maybe what we would do is bring the food to you. And so we went about the business of trying to open up a grocery online ordering and delivery and distribution service. And the way we did this is we talked to the people in the community and got their input, asked them would they be able to use it, or would they use it, and those kinds of things. And most of the positive things came back. We were concerned because a lot of the grocery stores that the people were shopping at did not take SNAP benefits online. And so we got with Walmart because they were the only one in the community, the only one within distance of here, about 20 miles from here, that would take the SNAP benefits. We checked out some of the other main grocery stores. We checked out the local grocery stores, and we only came up with one grocery store, and that was Walmart. So we went to partner with them in order to get food into the community. Now that we have done that, we have had another grocery store who have come online and say now they can take the SNAP benefits. Okay, next slide, please. Okay, when we first started, we had some challenges with this because a lot of people said, we don't really like using the technology. We've never used online before. We don't like not being able to go to the grocery store, and we just don't know how we're going to order online. So we did a lot of outreach into the community, meaning that we went and we had meetings and asked people to come to our meetings or whatever. And after that, we train. And so we have a facility. Next slide, please. We have a facility. We did set up a facility, and it's called Goods. Goods mean grocery online order and delivery service. We set that up so that the people would have somewhere to come in order to place their orders. Now, they do have the option. They have the option of ordering from home. They have the option of ordering from their computers. They have the option of ordering from their home and computer or their phone. However, we set it up because a lot of people in the community have not used technology before. It's a poor community. A lot of them do not have the internet. They can't get on the internet to make their order. So that was an obstacle that we had to solve. So we opened our own facility where we have a staff member there. And that staff member sits there and the people can come to the facility and place their order if they have no other options. Or we will go to their homes because we take a iPad to their homes and say, okay, you don't have transportation to come to our facility, we'll come to you and get your order. And so we take their order, they take their orders online, but they put in their alternate pickup person, and the messages come to us that the person had placed an order. So we know when a person places their order and what time that order is supposed to be picked up. Okay, the next slide. Okay, what we do, the way the process works, they put in their order, we have a driver, we have a refrigerated truck, a refrigerated vehicle that goes to Walmart to pick up the items. And once they get to Walmart to pick up the items, he bring them all back to our facility. And at our facility, we have freezers and we have refrigerators so that the people don't have to immediately pick their stuff up. For example, if a person is at work and they want to pick their groceries up after work, then we store them in our facility until they can get off work, then they can stop by and pick up their facilities at their convenience. We have the freezers and the refrigerator also for another reason, because we may have to keep it overnight. They may not be able to get there till tomorrow to pick their food up. And so we will keep it there in the facility until they're able to get it. Also, if they do not have transportation to our facility, we will deliver it to their houses. We'll take it to their houses, to their front door, and leave it for them at their houses. So we try to make it as convenient for people as we can, realizing that people do not have transportation, realizing that people do not want to pay anybody to take them to pick up groceries, realizing that a lot of people do use the SNAP benefits. So we were very adamant about we had to be able to take the SNAP benefits as well. And realizing that it's so convenient. And realizing also, one other thing we realized, that a lot of the people was not comfortable with technology. They just weren't comfortable with it. So we've gone through some training sessions. We've offered training sessions in our facilities where they can come in and we can train them how to use it, how to go online. We send out instructions, written instructions on how to use it, how to go online, step by step. How do you place your order? What happens when you place your order? Just trying to step them through it. And so next slide, please. Last slide. So in the end, on this slide, we see where our driver is actually delivering to a house. So the person don't have to come out, that person don't have transportation. This is really, really good for the elderly also. The elderly that can't get out and have no way to come to our facilities, we take it to the house and now they have their food. And that's what I have. So thank you.
All right. Thank you all so much for this amazing information. And I'd say like there's a lot of questions that have been coming in through the chat and the Q&As. So I want to start with kind of an open question for everyone, and then we can pop up some of the questions from the from what has come in from people. So, you know, all of you have talked a lot about how you've used online services, use that model to increase your reach. So I'm curious, for those who are here and learning from this session, what advice do you have for an organization looking to start offering more online services? So this question for anyone, and feel free to jump in.
What was the question again? I'm sorry, I missed it.
No problem at all, Gloria. You actually touched on this a lot in your presentation. So, you know, all of you have used online services for SNAP to increase your reach. So there's a lot of people listening today that may be interested in doing something similar. What advice do you have for organizations looking to start offering more online services?
The outreach is very important. Make sure you're out and meet the people where they are. Some people can afford to, come to our facilities, some can't. So just meet them where they are. If they're not able to come, the main thing is giving them the food, getting the food to their houses, getting the food to their table. So be patient with them. If they haven't used technology before, step them through it, all of those things, and realize that some people are not as computer savvy as other people are. So be patient, write out instructions, step them through the instructions, all of that we've done in the community, because the people say, I don't know how to use it. And so we do training sessions. But the main thing is just realize that meet people where they are and help them to get comfortable with using technology. That would be my advice.
I know for us, we actually were introduced to mRelief through a grant through Catholic Charities USA. And so we actually we're part of their pilot program. And so I definitely encourage organizations to apply for those grants. Because I know for us, we were already doing SNAP outreach work, but this just actually helped us do it more. And then also partner with other organizations who are interested in doing that work.
And we also, I can just step in again and say that we also did get a grant. We got a grant once we decided what we wanted to do. We were clear about we wanted to provide access to food. And we just made that clear to the funders that we are a food desert. People do not have access to go to the grocery store. We do not have a grocery store in our community, and we put it in form of a grant, and we got grant for the facility. And we also got some operating dollars to help us, because what we deliver to the people is free. They don't pay a fee at all. Everything is free to them. All they have to do is come in and order, but we got grants for both, for the facility and the operating.
Well, thank you, Gloria and Janelle. And I'll jump into some of the questions we got through the Q&A and the chat. So a few actually, Dr. Allison, were for you around the stores specifically that participated in your model and participated in what you were doing. Let me pull up the specific question so I got it for you. Were the grocery stores that the rural communities used for the online shopping major chains like Walmart, or did these include more local stores as well?
So it is, I have to be careful. I'm not allowed to say store names. So sorry if you want specifics, whoever asked that question, but they are more mid-sized grocery stores that people were shopping online at. So we've seen a growth through that SNAP online pilot that the USDA started. There's been a growth among many grocery store chains to offer that. So I can speak to the growth of that. So Aldi now offers it, Food City, Food Lion. So we were in Kentucky, North Carolina, Maryland for that intervention. And so, but smaller independent rural grocery stores do not have online shopping. So although I know a lot of the talk right now is focused on the customer side, we also did quite a bit, and I didn't present on this today, but on the grocer side. So what are the grocer's barriers to adapting online shopping? So until we can target those grocers, there's always going to be this gap in what people can access for online shopping. So that would be one policy that I really push, is that we eliminate the barriers and hurdles for smaller rural grocery stores to adapt SNAP online offering.
Thank you. And I'll add one other question that came in specifically for you as well, is did the online orders include a tipping option? And if so, how was that handled? I imagine for those shopping with SNAP benefits, either could not use their benefits on a tip or would understandably need to conserve benefits. But
Yeah, so
people doing delivery, need those tips. Sorry.
Yeah, so overall, just remember quite a bit of our sample was rural and there's no delivery. So I know people keep getting stuck, and I think sometimes we get stuck in the dialogue of like where we live. So just remember on our sample, like of all the orders, maybe less than 1% were delivery. So there just isn't a lot of delivery in the communities that we're working in. And so people overall then didn't want to have a minimum fee, a minimum order for delivery. So we haven't really tackled that. And I think most people that are doing online shopping in the communities that we're targeting are not doing delivery because of the barriers. But that's why I kind of brought that up as far as the suggestion is that if a retailer is SNAP authorized, I believe from a policy perspective, as do many scholars, that there should be no delivery fees should be waived for our SNAP customers. They are getting government dollars, and then therefore, why should that SNAP customer in a sense be charged twice? So that's something I feel very strongly about. And I think our data point to the need of waiving delivery fees for our SNAP customers.
Thank you. Super helpful. Zareena, we had a few questions that came in for you about mRelief that you answered a little bit through the chat, but thought it would be great questions for everyone to hear. So can you share with us, does mRelief only operate in Kansas or nationwide?
Sure. So mRelief's SNAP eligibility screener is available nationwide in all 53 states and territories that participate in SNAP. So anyone in this virtual room today could text the word food to the number 74544. And over text messaging, you could go through the process to find out if you qualify for SNAP. It just takes 3 minutes. You can do this now. And then we work closely with community-based organizations in 12 states. So Kansas is one of them. A number of others that maybe I can put in the chat because I won't be able to list them off right now off the top of my head. But we work closely with community-based organizations and states so that we can provide that application assistance that combines technology and automation with the human compassion and one-on-one assistance that our amazing partners like Catholic Charities of Kansas can provide.
Thanks, Zareena. So another question, and I think actually this can really be opened up for all of you, with some concerns about digital security and hesitancy. Have you all experienced any hesitancy about submitting documents or personal information via text or with online programming? And if so, how do you help folks overcome that?
I know for us, especially some like our older populations, or even just when they do receive like a flyer, sometimes people feel like this could be too good to be true, that someone will help you virtually. We do have the option that if someone wants to come into a family support center, they could come in and someone like either a caseworker or one of the managers or A volunteer will actually help them go through the process. And then either they'd help them fill out the paper application, or they could go through the Johnny system with them in person. But yeah, we have the option that people could call or come in physically to our family support centers.
Well, we do have a challenge because as far as our grant funding, the funders asking us to track certain things such as what are they ordering in terms of how much fruit are they ordering, how many vegetables are they ordering. And so trying to get that information from them or through the system without having their passwords and things like that is kind of difficult for us to do that. And you know, a lot of them don't want us to have their password because ordinarily we don't have their passwords. And so just trying to get the data that we need in order to measure how, you know, what kinds of food, whether the food is healthy for them or not is a challenge. And they don't really trust us to be able to do that with their passwords.
So I will say we collected receipts. And so we would have people screenshot their receipts or they could email their receipts. And they were pretty open, you know, to providing that information. But I will say they felt a connection because we were texting with them so much, you know what I mean, during those weeks, that they felt that there was that, like they, you know, they trusted the University of Kentucky, they trusted that entity. And so I think back to what Gloria and Chanel are saying as well, I think you need that community connection and that trust. Yeah, I just think you do.
Well, I agree with you. I think so. Some people we have a great connection or relationship with, are okay with it, you know, and some are just not. So it just depends on the person. And usually the ones who are not trusting are more like the ones who are not computer savvy and the elderly and those type of people are really not as trusting as some of the younger people.
And I think just to repeat, the power of the partnership and having a community-based organization really helps us to build that trust. Because I know Chanel talked a bit about the mobile resource bus. So if someone isn't comfortable completing this process over the phone or using their smartphone, there are ways that these community-based organizations can meet people where they are and help, you know, wrap up the process with them if they need that. So I think one really important part of this is the choice or the ability to choose which process works best for the client, so that they can feel comfortable and secure when they complete the application process.
Yeah, and like I said, we are a community-based organization, and we as a community are working on several issues, and this just happens to be one of them. So we're building relationships about a lot of things that goes on in the community. So we're slowly building the trust. We've only been in existence for about 6 months, and we started out with about 5 to 10 families coming in to ordering online, and now we're up to about 40. So, you know, the word of mouth is getting out there. People are beginning to be more comfortable with being able to order online and have it delivered to them.
Thank you all. I really love how much the intersection here of the need and the importance of relationships while still using online services and how those really interact and can really lift up and support each other. I love that. So Zareena, I think you're answering a question in the chat, so I'll let you do that. And I'm going to open up another question for the full group. You know, you all are doing really innovative work on opportunities to access to resources and services through technology for rural communities. And I'm super curious from your perspectives, what does the future of this work look like for you? What are opportunities that are out there to continue in this direction?
One of the things that we've decided to do, because we have a facility and we've we have technology at our facilities, webcasting or whatever. We are planning to open it up to, because the community has been asking for some nutrition classes around what's the best foods to eat. And so we can offer that in our facility as well, those nutrition classes. And so we can get people eating more healthy than what they are now. So that's one of the opportunities where we start to involve the community more in maintaining good health by not only bringing their food to their doors, but also being able to train them and teach them cooking classes or whatever in order to make this a more healthy community. And we can do that, virtually. We have the capability of having a classroom with the participants, up to 20 participants in a room, and have someone come in virtually and teach the classes at our facility.
So Zareena and Chanel, if I'm over speaking, I can stop. Or I can just give my kind of what we're doing next. Okay. I have a habit of controlling the room. And so I'm working on that. That's something I'm personally working on. So one thing that our study team, which I'm super excited about, and hopefully every single community partner in this room will be also excited about. So we have developed with UNC, University of North Carolina in Greensboro, Dr. McGirt, myself, and then the two investigators that are on this, we've actually developed a shopping avatar. And so her name is Rosa, for Rural Online Shopping Assistant. And so she is a browser extension. So if you go onto Google or Firefox or whoever your search engine is, then you will be able to download her, and she will help you with your online shopping. So she'll help you set up your cart. She'll help you look for digital coupons that can be used across different venues. And then she will also give you tips and tricks. So for meal planning, meal preparation, recipes, but then she'll also give you healthy nudges. So if the person has put too much soda and too many chips, she'll say, I noticed you have a lot of processed foods. Did you think about adding apples to your cart? That might even out the amount, and they're on sale. And so what we're hoping eventually is, we'll find out next week if it gets funded. And it also uses artificial intelligence. So the more you use Rosa, the smarter she gets. And so she adapts to your shopping cart needs and what your preferences are, while also kind of maintaining those nudges about healthy eating. And so we'll find out again if it gets funded next week. But the other component that we're really, really hoping to be able to utilize in maybe 2 to 3 years is that for those people who put in maybe some of their demographic information and they're not on SNAP, she would then encourage SNAP enrollment, and she would encourage you to get linked to different SNAP offices and WIC offices. So we're not there yet in the technology. We are still on the purchasing side of it, but it is something that we're very interested in developing and working with lots of community partners to help with that. So that's kind of where we're at next.
That's awesome, and I hope that Rosa gets funded. I believe I'm speaking it into existence. So from mRelief's end, we are really excited. We've been able, as of last year, to connect over 1 million families nationwide to SNAP benefits through our eligibility screener and tech-based resources. But we know, like Chloe mentioned earlier, there are still 9 million people in the United States who are eligible for SNAP but not enrolled. So there are still really significant barriers. So I mentioned that mRelief works with community-based organizations in 12 states. We're expanding this year to an additional 6 states. And with that, we're really excited to build these coalitions with organizations like the Catholic Charities of Kansas to be able to combine the tech-based SNAP application assistance with that human compassion that our partners provide.
Thank you. Oh, Chanel, please.
Yeah. So I know for us, we'll continue on just doing the SNAP outreach, but one thing that's really helpful, we have a lot of community partners in our rural areas that we're able to at least send that text number virtually to help reach out to more individuals, but then also with our resource bus, when we are going out to the communities, we're able to keep reaching out and expanding that direction. And it's nice that at least right now we have the option of the technology portion, but then also help people in person go through the application, help them fill that out.
Thank you all so much. I'm excited about these future opportunities. So we're getting close to the end, but we did have a question come in. And so really open to anyone. I think you all might have ideas about this. How do you fight the battle of this triangle of food, technology, and transportation for families who aren't near a big city or live in the country?
Well, we are a rural area. I mean, we're very, very rural in the Mississippi Delta. The people do not have, a lot of the people do not have transportation, and a lot of them do not have access to technology. So the way we did that, we provide the technology. We go to them with the technology. We do whatever we can to get them, if they don't have transportation to our facility, we pick them up and we take them back home. You know, we do those things because we realize that a lot of them don't have access to the internet or access to online shopping. So we try to go beyond what, just saying go online and order and we'll deliver it to you. Because we realize that some people are not able to do that. They just don't, they're not able, but they still need the food. And there's not a grocery store around that they can walk to. The nearest grocery store, like I said, is that they like to shop at, is probably about 20 miles away. And so we just have to go beyond and recognize that we're not, there's no equity in that. Some people can get transportation, some people can't get transportation. So we have to deal with these equity issues as a whole. And how do we deal with the equity issues? We have to lift up people in different ways and work with them in different ways and try to bring some equity to the community. So that's my answer. Just do what we can do. You know, we're gonna do whatever it is we can to get you get that food to you so that you can have healthy eating habits. So we need some equity policies. I guess it's some policy, how do we do this with people we know just don't have the money, and people who are living in poverty that can't access food, even though they make them access a SNAP card. Some of them can't do that. So that's good that we got someone on that side who's working on them filling out that application to get SNAP in the first place. That's very, very good. And then so when they get eligible, then how do I get to the store? We got to work on that part too. How do I get my food?
Thank you, Gloria. I completely agree. Let's work on the equity policies. Thank you all so much. Thank you to our lovely panelists for sharing today. Thank you to those that participated in your questions. It was such a great session and I learned a lot. So thanks, everyone.
Thank you.
Thank you.
Thank you.
Thank you.